Hi, this is Dr. Denitza Blagev, and I'm here at the American Thoracic Society meeting in San Diego, talking to Dr. Daniel Mendoza, who's a researcher in the Pulmonary Division and Atmospheric Sciences Department at the University of Utah. And Daniel, we're learning a lot of interesting things about air pollution here at ATS. Could you tell us about the study that looked at air pollution in the elderly?
This is a very significant study because it's actually a study that has followed the Medicare population and has a large number of participants and looks at some very novel techniques.
And what kind of outcomes are they looking at for this population?
What's very interesting is that they're looking at fairly low levels of elevated pollutants and the outcome in terms of acute respiratory distress.
So really severe lung complications that are pretty rare in the general population. And what did they find?
Well, what they found, which is very interesting, is that even in very small levels of increased air pollution, they found an increase in hospitalizations.
And what kind of increase in air pollution was significant?
In this study, they were looking at the increase in hospitalizations when looking at just 1 microgram per cubic meter increase and 1 part per billion increase in particulate matter and ozone, respectively, which is very modest compared to, for example, the National Ambient Air Quality Standard, which is 12 micrograms per cubic meter for PM2.5 and 70 for ozone.
So it sounds like even really small variations in increased air pollution can have these devastating consequences in terms of acute respiratory distress syndrome risk. What can people do to prevent this? How concerned should we be about this?
I think the fact that they found this statistically significant increases in hospitalizations based on just very small air pollutant concentration increases really tells us that we need to be studying this at a more granular level, that it's no longer enough to just look at one observation station and then assume that that's the same exposure for the whole county or the whole region. So really, everyone needs to be more aware of their exposure and take preventative measures such as, for example, staying indoors during poor air quality days, trying not to exercise outdoors, and potentially wearing a mask if necessary.
Thank you very much. Thanks, everyone, for joining us.